Hi, everybody. Nice to see you this morning. So many familiar faces and names. Thank you for joining us. We'd love to see you on screen if you want to be on screen, or not on screen if you don't want to be on screen. We're really, really happy to be here, and we're just waiting maybe one more minute before we start to let people sign on, and we will go from there. If you want, it would be great if you put, Hayin's already chatting away. So if you can put your name and your role and where you're from in the chat, that would be awesome. So we can see everybody who's here. And then, yeah, Jamie just put something in the chat for everyone, just as people sign on. All right, I think it's Ben. Hi, everybody. It's so exciting. I love seeing everyone's names too. Larry, love it. Okay, we're going to get started this morning so that we can have this super critical conversation and both share the information that we have to share, but also get input from all of you. We really encourage everyone to ask questions in the chat during the webinar, and we are going to spend time at the end talking about those questions and answering them. We really, really, really like these conversations and presentations to be interactive, and also my goal in any forum like this is to answer people's questions that they walked in the door with, whether we do that in this forum or whether we do that in follow-up office hours or conversations. That's our goal, and that's what we're here to do. And so thank you so much for being here. And also just, I can't say enough about thank you for doing the work, because this is critical work of integrating California's child serving systems in California, and it is not easy work. And so we celebrate everybody who's here, who's united in care. We can go to the next slide. We wanted to thank our sponsor, the Mental Health Services Oversight and Accountability Commission, for sponsoring this. They have been a very, very close partner of ours in working on integration of the child serving system in California for 8 years now. And so we just really want to say thank you for giving us the opportunity to do this with all of you. My name is Elizabeth Estes. I am the founder of Breaking Barriers. I'm also a career children's attorney in the state of California. I started representing minors in child welfare and probation, and transitioned to representing education, and actually came to this work through my own work on the ground as an attorney in the system, realizing that the system is not united in the ways that it could be. And we're not united with our communities in the ways that we could be. And if we did do that work very intentionally, we could improve services and supports and outcomes by, for, and with children and families in California. So I'm just thrilled to see where California is now, that we are really digging in. I'm joined by Richard Knecht, who's the managing partner at Integrated Human Services Group, who has a career in system of care and children's service integration work. And we've been working together for years now in Breaking Barriers to support the field, and also to incentivize and support the state in moving this work forward. And also by Hayin Kimner, who is a career expert in community schools and running the community schools learning exchange. I'm just so thrilled to be able to connect them and their minds in this work towards the development of an integrated system in California. So they will be presenting in a minute here. Next slide. Our agenda today is going to be welcome and engagement. And I'm going to be talking about the need for integration and why it is so important, and also just the opportunities that we have right now, which I've never seen before. Certainly in the decades I've been working in California, trying to support children, families, and those that serve them. Specifically, we're going to concentrate today on two major opportunities system of care and community schools, and how to connect those towards the development of an integrated system. Next slide. What is the need? We were asked, Breaking Barriers was asked by the Health and Human Services Department last year to write a white paper on how to build or how to actually achieve the outcomes of the Child and Youth Behavioral Health Initiative in California, which has its own 14 work streams. We did do that, and we interviewed hundreds of people across the state and the nation about how to enable the Child and Youth Behavioral Health Initiative to actually transform California's child serving system, as it says it would like to do, into a more comprehensive, accessible, navigable, and effective children's system in the state of California. In the midst of that, we did an analysis of the need in California, particularly in the mental health space. And the data, as we all know, is extraordinarily concerning with relation to the children's mental health crisis. And I would also add that the data with relation to children's outcomes globally are not what we in California would like them to be right now, particularly post-pandemic. And so I think the work of creating a holistic child serving system that addresses the very real need that we know across both, holistically across children's needs is just critical right now. Next slide. We have a wave of energy with relation to doing just that, creating a holistic child serving system in California and addressing their needs globally and uniting our agencies in that effort. And so we created here a slide of the wave of energy and resources that create just an unprecedented opportunity for transformation in California. And also the challenges of coordination on the ground. We are already hearing, if those of you have not heard of it, about the Plandemic or Plandemonium with all of the initiatives and efforts that have been pushed into the system right now in California, and all of the efforts to create a more supportive system for children and families and those that serve them. It is a lot of reform, simultaneous reform and allocations. It presents this extraordinary opportunity, but it also does create a lot of challenge with relation to implementation, particularly at the local level. And this forum and this convening is really all about how do we take parts of that work and unite that in order to create a holistic system and build steps towards the development of that system at the regional and local level. So we have both opportunity, we have need, we have opportunity, we have challenges, but I have absolutely no doubt that we can overcome those challenges with intentional work towards integration, unity, and an understanding of the work that we all need to be doing in the system. Next slide. So what is the path forward? Within the confines of the work that we've done in the past year, we've issued 2 publications. One is the Integrated Services Field Guide, which you can access on our Breaking Barriers website and here, and which creates a summary actually of a number of the initiatives that are in the system right now, whether it's early care or aftercare, system of care, or community schools that we are implementing and should be understanding and nexusing with one another, and steps towards doing that. And in addition, we published the ecosystem working paper in order to publish the steps towards creating or towards effectuating the most effective child and youth behavioral health initiative we can in California in order to transform the system, which is everyone's goal. Both of those include very detailed information that can be helpful towards implementation strategy at the local level. So we encourage you to use them and to contact us also if you have any questions about them or the information that's included therein. Next slide. When we did our research study for Health and Human Services regarding the CYBHI and implementation of the CYBHI, we did an analysis of what is necessary in order to transform the system to make it as effective as possible for children and families and those that serve them. And our conclusions are here, outlined here. And it really is critical that we have an integrated system that surrounds itself around, by, for, and with children, youth, and families, with all of the agencies that are touching them simultaneously, but historically not necessarily connected to one another in defined goals and outcomes. In addition, critical findings in our paper were that we need to center children, youth, and families in our shared leadership. We need them to be a part of our shared leadership. We need their voice, both in the development of our leadership, in the implementation of our supports and systems with them, and also in our quality improvement and control processes as we are implementing all of this reform in California. We need a larger culturally responsive and congruent workforce. We need incentives for integrated financing and maximization of state and federal funding and resources. And we need training and coaching in order to do this work. And we need that work done at the state, regional, and the local level. And Richard and Hayin are going to get into how can we use system of care and community schools to do this ecosystem building work. Next slide. We found in the ECO paper that there were 20 necessary components for an effective system in California, and they are listed here. And they fall into three main core areas: a shift in our vision, mindset, and culture, a shift in our structure, organization, and resources, and a shift in our function, process, and outcomes. And we will be talking in the next slides about how to realize these necessary components of the transformed children's system that we are all shooting for moving into the future. Next slide. I'm going to turn it over to Richard to start discussing who are the core child serving agencies and the system of care work in California. And just once again, thank you so much for being here, and be sure to put any questions you have in the chat. Thanks.
Elizabeth, thanks for that framework. Really thoughtful, and sets us off on into a place where we can have a conversation about the confluence of two of these really extraordinary opportunities within that larger wave of opportunity. And what I'm going to do in the next couple of slides is just set a little more context, and then I'll do a kind of a deep dive on system of care. Hayin will then take us deeply into community schools. And then what we're going to try to do at the end is identify 2 or 3 really critical nexus points where the community schools work and the system of care work are mutually supportive and interdependent, because there's just great opportunity in this. So by way of context then, most of you know there are at least 6 kind of core essential organizations. California is structured in this highly bureaucratic way, right? And we're pretty siloed historically within most judicial or jurisdictional systems. There are these 6 providers, and this does not even include many of our early childhood entities like First 5, right? It doesn't include even the County Office of Education, but this is a quick look at the kind of responsibility zones, if you will. And in the next slide, which we'll transition to now, you'll see we'll do a deeper dive on this in terms of what their responsibilities are and the funding, a quick look at some of the funding opportunities that are available that can potentially support and sustain this. So Deanna, give us the next slide if you would. These are the same 6 entities, right? But what we've done here is just given you a little more detail about what their obligations are. This is landscape setting, right? So because we're going to dive deep on 2 critical initiatives. And in order to do that, you really got to understand the landscape. The complexity in California is vast. So you'll see county mental health, the regional centers that have responsibility for developmental and intellectual disabilities, the managed care plans, which are not historically connected to our systems of care. We're rolling out significant obligations on managed care, particularly under CalAIM, which we'll maybe get a chance to talk about. There's county social services and welfare, courts and probation, right, and then local education entities. Each of them has a finite set of responsibilities. And over the last, part of the problem we have with implementing any new opportunity like community schools, like system of care, is that we are so fragmented in this structure that each of us has this sense that we're only obligated to serve some kids or to meet some of problems of some of those kids, right? And it really takes us out of a whole child, whole student kind of approach. The second line here is intended to give you kind of a high level look at the primary funding sources that each of these entities has opportunities to be responsible for. And we won't dive deep on any of these other than to suggest that we often operate from a perspective of scarcity in California. And we say to ourselves from our own silo, I don't have enough. And the takeaway from system of care as it relates to community schools, which we'll get into, of course, is when we are in authentic partnership with other departments and agencies, that scarcity becomes mitigated, right? We discover that there are tools and toys available to us to play with that belong to each other. And when we share them, the scarcity is, it's largely mitigated. Deanna, give us the next slide if you would, thanks. One more piece of context here before we get into the nitty gritty. The imperative to build an integrated system lies upon all of us. And there is a fair amount of research here from a very broad basis of collective impact socially, right? And from a health perspective, and more specifically to systems of care as it relates to kids and families. And all of that research brings us to some awareness that there are what we might consider pillars, right? Or anchors to this collective impact work. And those pillars can be roughly identified with various iterations within the literature, right? That shared collective leadership, like a vision for all of our kids, is pillar number one. We also have to have a shared set of outcomes and goals to which we're all striving. So a quantified North Star, right? We have to be able to thirdly share information, data, and the pursuit of effectiveness, quality, if you will. And we have to be able to share the dollars. The research again suggests that if we do those four things consistently, sustainably over time, then we get impact, but only if we implement them and drive collectively towards them. Next slide. So with all of that context from Elizabeth and that additional framing around the architecture of delivery system, this is the interdependency. So it's easy math. If you combine a healthy community schools effort within a system of care architecture, that you get success on both fronts. And if we can't do that effectively, then our efforts to implement either of those initiatives is probably limited on some level. This is to suggest that unless and until county agencies address the long-standing gaps, the disconnections, the relationships amongst them, that the community schools efforts will be limited in their impact. Likewise, local, accessible, community-based programming for kids and families, which is the pursuit of the system of care writ large, will be largely unrealized, absent delivery points that are also connected, places like community schools. So I hope we hope that this interdependence is clear now, right? The system of care work writ large needs effective places where kids can access integrated systems. And those local access points, like community schools, need the system of care writ large to be effective in bringing the resources so they can be delivered, if that makes sense. So this is the interdependency we're going to try to highlight. All right, so let's dive deep then. Deanna, thanks on system of care. This is just a quick transition. Most of you may have either heard about Assembly Bill 2083, now almost 3 years old, but it obligates each of California's 58 counties to and their regional center partners to a mutually defined a commitment via a memorandum of understanding that establishes, based in research, the essential elements of collective impact for kids and families. We want to emphasize here that a children's system of care is not an initiative. And this is going to challenge some of our notions around this, because it's framed as an initiative, right? It's something we have to implement and do. And yet, if we think of it as an initiative, it becomes one more thing we have to do, instead of understanding that if we can effectively implement a system of care opportunity as required under AB 2083, we're actually creating not another initiative, we're creating an architecture into which every other initiative can be placed for future implementation, for current and future implementation. And this is important. Big takeaway for you all from today is, as you're involved with, or could be potentially going forward, involved with your system of care work, try to think of it as not another thing we're implementing, but a new way of being together, right? And seeing our relationships together. The MOU that's required here has to address very specific functional elements around collaboration, including leadership, information management, privacy, data sharing, maximizing the dollars, all those key ingredients. It's the blueprint, right? We'll talk about this in just a second, the blueprint to your effective work. It does not obligate to shared governance with kids and families. We hope in many counties we are doing that. And we know that there are some that are tackling this, that even though the state's 2083 work doesn't require it, we're seeing some counties really dive deep into some authentic consideration of how families and youth will inform and share responsibility for the system's deliverables, if you will. Another critical takeaway here for many of you, particularly if you're in the education arena, AB 2083 is a little bit misidentified. And I'll just pontificate on this for a second from a consultative standpoint. We've identified 2083's target population as being foster youth who've been traumatized, right? And there were reasons that state had to do it that way. I want to be sure that we understand that a good system of care can't have a target population of one set of youth, all right? A system of care, by its very definition, establishes impact for all young people who are at risk, all right, and who need care in any of the partners' arenas. So the foster youth system of care is a bit of a misnomer, and we have to understand that if we're going to implement it effectively going forward. Next slide, Deanna. So really quickly here, this system of care is based in 35 years worth of research. We'll look at those outcomes in just a moment. And the good folks at the Substance Abuse Mental Health Services Administration have a well-established definition. And I'll give you a second to ponder on these really lovely words, because these words contain the values and principles, which are also the pursuit of a good community schools effort, right? Like the very same thing we're trying to do with community schools, it's what system of care wants to do, right? And I can't ever remember this definition, but what I can remember is that me and my partners, we're all together sharing responsibility, risk, and reward. The 3 R's of system of care, right? I can think about that easily and remember that anytime anybody asks me, well, what's that system of care thing? Well, we're sharing responsibility, risk, and reward. Next slide. So underneath 2083, the system of care has obligated partners. These are, again, are the child welfare entity, the county mental health authority, regional centers, the county office of education, not the districts. And this is one of the challenges with California's service delivery architecture, right? The county office is obligated to sign off and participate, and they are in most counties. What we're missing is that link to the service delivery systems, which are the local education authorities, right, the schools. Juvenile probation is an obligated authority, and then through consultation under a recent trailer bill, our tribal authorities are also invited into system of care, and counties are working towards adaptation there. we want to emphasize that while those are the obligatory parties to system of care, there are other collaborative partners represented here on the right side of this, which include people like entities like First Five, right? Critical connection point. Many counties have included the First Five in their MOUs. If you're in a county and you're connected to the system of care work and your First Five people aren't there, we strongly recommend that we find a way to connect there, particularly under the Family First Prevention Services Act and the CalAIM work that's going forward, like the 0 to 5 POP. That's where we can have greatest impact, right? Family resource centers are another one, local hospitals, any other CBOs, dependency court judges can be powerful voices in collective impact work. And we have evidence for that here in California, where some of our counties have presiding bench officers who are leaders in the system of care work, public health, of course, and increasingly, again, under CalAIM and other reform efforts, managed healthcare plans are going to be critical partners. All of this makes collective impact way complex in California. I'll just share for a second. Most of the entities outside of California have built good systems of care are premised in welfare, behavioral health, and sometimes probation, youth corrections, right? In California, we've raised the bar significantly. We've got all these additional partners that are required, and then others, because we're so well endowed in California and have so many resources, we have other entities that could be playing. What that does is makes collective impact more opportunistic, but also more complex, right? Because the more people you have in the sandbox, the tougher it is sometimes to make collective decisions around where a county is going to go or where a system is going to go with its work. But it's a great opportunity. But this is a look at the required partners. Deanna, next slide. Here is, again, the elements of the MOU. So think of this as the blueprint to effective system of care work. If you're unfamiliar with 2083, again, the MOU that the state requires of all 58 counties and their regional center partners has 11 essential elements, and this is a quick look at those. And so what we know is when we do interagency leadership, when we have a practice model that holds us, that gives us a common hymn book from which we will all sing, right? A singular practice model. When we have high care coordination through something like interagency placement committee, right? When we have effective assessment and screening, effective teaming, care coordination, the sharing of information, the sharing of finances, when we train and cross-train, and when we solve our disputes together, when we do these things consistently and sustainably, we get impact. The critical factor here is we have to implement these 11 things. It's not enough to have pretty words on paper. And right now, after 3 years, I'll just say, as an external consultant in a lot of places and across the state, we got nice MOUs, we got very, very little implementation. And that's the problem we got, is we got to actually implement the system beyond the words on the paper. Next slide. Thanks, Deanna. You're doing great, by the way. This is a quick visual look at this point we're trying to drive home, right? Which is the system of care is not an initiative. It is an architecture and a collective vision into which many, many reforms can be placed. And we've got just a small subset here of the dozens. You remember the wave slide that Elizabeth oriented to a few minutes ago. Well, SB 75, Medicaid school reform, right? Community schools we're talking about today. CalAIM, eligibility expansion for Lantrum and Petrus Short, the behavioral health, the Community Behavioral Health Initiative, right? Family First Prevention Service Act. The list is endless in California of reforms. We have well-intended legislature and governor. We got associations that want to maximize opportunities. We have an endless flow of opportunity, but we don't have an architecture into which to put those reform efforts. And so we often end up shotgunning this stuff out there and hoping that it sticks on the wall, right? Instead of having a structure of a system of care into which we then have conversations around how will we plan and do the sustainable work. So we want to get to if we want to get to effective implementation and outcomes, we got to have a structure and a common hymn book, and the system of care provides that, at least in its intent. All right, next slide. I'm going to go quickly here. Think of a system of care as having kind of 3 lenses or perspectives. It is all 3 of these, and all 3 are necessary, right? It's an ideology or a way of visioning. Think back to Elizabeth's slide around the vision, the structure, and the function. The system of care provides that. It's ideological in having a vision statement in the MOU. The structures of the MOU allow us to share the necessary resources, and the practice model, ICPM, which will soon be released again in 2023, later this summer, provides us this common hymn book so we can harmonize. We all sing from the same book of scripture, if you will. And this parallels the structure of the community, the California Youth Behavioral Health Initiative, which Elizabeth outlined for us before. Next slide, quick look at the impacts here, just to drive home the opportunity. In 35 years of research in and outside of California, when jurisdictions do system of care work well, we get these kind of outcomes. We get decreased behavioral and emotional problems, we get less suicide, we get reduced caregiver strain, better family functioning, an expanded array of services, right? So we're always looking to expand the capacity in our local communities. Well, system of care gets us there, right? We get better school attendance, less dropout, significant decreases in inpatient need, and less cost and trauma in youth corrections. And this is just a fraction of the outcomes. There are about 40 of them, right? So I hope it's clear that many of the reform efforts in California over the past decades would have been amplified if we had bothered to invest 40 years ago in interagency work. Does this make sense? And that's why this moment is so critical, because we have powerful opportunities like community schools leading here, that if we do it in an interagency architecture, we're going to maximize or exponentially increase the impact of something like community schools. All right, with all of that by way of community schools, and we will have time for questions later, I'm going to pass to Hayin, my esteemed colleague, who's going to give us the lowdown on all things CSPP.
Awesome. Thanks so much, Richard. Again, my name is Hayin Kimner. I'm the managing director of the California Community Schools Learning Exchange. Richard, when he talks about systems of care and integrated systems of care, I just think, check, check, check. That should be community schools work. I have been doing community schools work for about 25 years, and to say that there has been an evolution in the thinking of this work is an understatement. And to also say that this is brand new work, that this is brand new ways of thinking and being. Sid, to your comment in the chat, in a lot of ways, we've tried this before. The challenge is that we haven't actually ever really appropriately defined what this is. So with this particular moment, with an enormous investment in the California Community Schools Partnership Program, it's really important that we're clear on what this is. So I'm going to take you very, very quickly in terms of the evolution of where we have come from and where we are now and what the opportunity is. Next slide. So initially, when we would talk about community schools back in the late 90s, early 2000s, oftentimes we would depict the need for community schools with this cartoon. And when we present this, and there's more opportunities for to cold call people to describe what's going on, what folks usually say is, oh, there's young people in our schools and they're carrying all this baggage, and it gets in the way of them learning. And some people say, we have adults that don't know what to do. They're passively standing aside. We've got other young people that might not really understand what's happening, and are they getting their needs met as well? And so the response was this, the phrase, schools can't do it alone. Teachers can't be responsible for all of these things. We have all of these other resources within the community, within public agencies. Let's wrap around the school, right? And so it was community-based organizations from expanded learning, youth development. We had our social services folks coming in, our food bank, right? We had our physical, behavioral, mental health folks, the quintessential dental clinic of a community school. And then these ideas around family support and engagement, where it was less about talking about families as partners and more about how do we support parents to be better parents, right? That might be taking it a little bit too far, but I think you know where I'm going with this. And this idea that we would wrap around pretty much only when schools had room for us, or when schools had budget, or when schools would say, okay, here's going to be the warm handoff. We end instruction at 2:15. After school, you're all in. Well, there's a little bit of there's a couple of words that I've become a little bit allergic to, not because conceptually they are all wrong, but the idea of wraparound doesn't get to the core of what we're talking about in terms of what the science of learning and development tells us about what is actually needed for young people to thrive. We don't wrap around schools. We need to reinvent schools. We need to infuse schools with these new ways of being. And by new ways, I don't mean that's like, oh my gosh, this is some brilliant idea that the research just came up with. All of us know that young people need to be engaged and curious in their learning. They need to feel safe in their learning, that there is an element of culture and belonging that needs to be part of community schools. So next slide. The next way that we have been thinking about this, and this is a shared definition that comes from some recent work happening nationally with coordinating partners, the Coalition for Community Schools, the National Center for Community Schools, the Brookings Institution, as well as the Learning Policy Institute, where we aggregated the expertise and the practice-based evidence, right? Not just the evidence-based practice of folks to come together to say, what do we really mean by community school? If community school is not just co-location or a collection of wraparound programs and services to fix, you name whatever problem it is and deficit it is, how can we best explain what community schools is? And what Richard said is so important, and like underscore 100 times over, if there's one thing that you're going to take away from this, this has to be a strategy. This is an initiative. For God's sakes, this is not a grant program, right? A community school strategy is about not just that place, but what is the set of practices, systems, and structures where we're engaging educators, community members, families, and students working together to strengthen conditions for learning and healthy development. That's very different than saying this is about targeting poor kids. This is about targeting, as Richard said, foster youth, right? Our young people that are within these other systems. And that this is, as a strategy, about organizing in and out of school resources, supports, opportunities, and the voices so that young people are thriving. Next slide. Let's actually go through, I know I said I wanted all the animations, but I could talk about this forever. The other part of the work of Community Schools Forward was a framework. Some folks here might be familiar with pillars and describing community schools in terms of pillars. The pillars work actually came out of a meta-analysis by some folks at the Learning Policy Institute, where the question was, what does the literature to date tell us about common features of community schools? And they came up with these pillars. Well, that's a very different research question than how do you do this work, right? And so this Community Schools Essentials framework is really built around this question of, well, how do you do it? It's not just enough to say, what do we know so far about common programmatic features? And so this way of thinking about it is we need to really focus on why we do this work. This isn't fixing kids. This is about all students flourishing in thriving school communities. So Crystal, to your comment in the chat, where does prevention fit, right? This is about not just early intervention, but prevention, as well as who is part of this work. The next piece, which is really, really important, and this has been decades of, you can go one more, Deanna, is sort of this flywheel. If we're not paying attention to these enabling conditions for doing this work, it doesn't matter. Funding's going to come and go, initiatives will come and go, programs will come and go, staff will come and go, leaders will come and go. But the efficacy of this strategy work, whether we're talking about community schools or systems of care work, is that these enabling conditions must be attended to, because that is what, next click, that is what actually anchors these programmatic key practices, right? And so these key practices are the things that might show up and be funded by a grant program, but without really thinking about how they all fit together, then it doesn't, then it's just a program that has a beginning, middle, and an end. The pillars are there, right? You can notice that, especially those folks that are familiar with the CCSPP grant and the California framework, those pillars are there. You can click twice, Deanna. But also the importance is, one more, this supportive infrastructure. And if we don't have supportive infrastructure in place, then this too will end. So this speaks again to what Richard was talking about, is that if you're not going to have the system to organize these pieces, then it's not going to be sustainable. And whether these C's, whether it's fiscal uncertainty, leadership uncertainty, or any of that. Next slide. So where we have come from back then to now. And when I show people this slide, I'm not going to go through it. Everybody can read. One of the big ahas that come is like, oh, well, we're actually doing community schools in a way that looks a little bit more like the then and not so much as a now. That's not a bad thing. It just means know where we're trying to go, right? The point of actually using, for example, grant monies like the California Community Schools Partnership Program is not to stay in this space of really thinking about community-based organizations as vendors, rather as partners. This isn't about targeting struggling schools or struggling students or struggling families. This is about developing this system of doing school in a way that is equitable and asset-based and meets the needs of our students, families, and communities. Next slide. So a little bit about California Community Schools Partnership Program. To be totally short, it's a hell of a lot of money. $4.1 billion is in comparison to the $75 million of the US federal community schools grant program that just opened a couple of weeks ago, and that will be closing this round in July. And that those allocations are not only to LEAs for particular schools and district work, but also to county offices of ed to support those grantees and to facilitate the coordination of support services. Huge, just like a setup for really thinking about the integration of systems of care and community schools, as well as technical assistance. Next slide. And all of this other money, right? So in our county offices of ed and in our LEAs, our fiscal services people are freaking out because there's a ton of money. And at the same time, the truth exists that there's a fiscal cliff, right? That the ESSER dollars are going to be dried up, that our pension liabilities and our other just like big ticket HR staffing items have gone way up. What are we going to do? So this is not just about the embarrassment of riches of California. This is actually thinking about, we don't have an embarrassment of riches in California. We got to think smarter and scrappier about how we're going to make do with the resource that we have. Next slide. This can't be the way that we do our work. Whether it's community schools or integrated systems of care, if we are just focused on what is happening within this picture, where we have very well-meaning folks all representing very different interests. And again, this is a little bit of poking fun, but there have been some meetings where these are basically the direct quotes, right? Where we're all advocating for our own interests and saying, well, it's really important that we do this. And in the interests of equity and in the interests of young people, we need to do X, Y, Z. And what's the reality here? The reality here is that we have a school that is both on fire and sinking, and a young person that appears to be screaming for their life. These are truths, right? And what is it that we're going to do with this particular opportunity to actually resolve this? One piece is maybe we don't need to wait till the school is sinking and on fire. maybe that we need to be investing in and really thinking about and taking lessons from our early childhood folks to say, this is about healthy growth, development, connection, belonging as part of prevention. And that education is really, really well poised to underscore the possibility and the assets, not just be responsive, right? For folks who are well-versed in multi-tiered systems of support, this can't just be tier 3 if we're not taking seriously tier 1. Next slide. So these 3 key intersections and the key role specifically of the County Office of Ed. Next. When we're talking about that role of the county offices of education, and this goes a little bit to that piece around the coordination funding within the California Community Schools Partnership Program. What is the role for county offices of ed? And this has been kind of a big question generally for decades. What is the role for county offices of ed in supporting this work? And, you know, when the whole point of this conversation and breaking barriers and the work that Richard has been doing and that of the Community Schools Learning Exchange is really recognizing how is it that we can be galvanizing these public agencies to be working together to advance not only care, but redefining care as being about prevention and support at the same time. Next slide. And I think, Richard, is this you?
Yeah. Hey, and thank you. Really, every time I hear you talk about community schools, it just rekindles a fire for getting this work right. It's such an extraordinary opportunity to do the right thing for so many kids. So thank you. All right, we've got ample time set up for Q&A at the end. So we're going to just pace ourselves through the last few slides here. You've been oriented now to system of care. You know what community schools are and the opportunity there. What we want to try to do in the next 3 slides is dive just a little bit deeper on 3 where we feel there are 3 really important leverage points for collective success between the initiative of community schools and that opportunity and the system of care outcomes that are desired. The first, we're going to call these interdependencies. All right. So the first one is information and data sharing. This is not news to anybody, right? Unless we can solve the FERPA, HIPAA codification storm that is healthcare and education rights privacy, we will be limited. And so what the system of care invites of leaders there is to figure out, for instance, how we might use a release or authorization for disclosure of private information, both educational and health, to increase the access and timeliness to care, right? We know healthcare at large suffers from this dilemma of not being able to get kids into care or coordinate that care because of privacy law. We could talk about this for hours, but it's a big obstacle, and the system of care gives us an opportunity to solve that problem. There are a few counties that we know of that are driving towards and doing early implementation of a universal release of information form, for instance, that would apply to all the partners in the system and hypothetically ease the burden on the system for chasing paper, right, or chasing signatures, because the timeliness factor in getting access to care is such a critical one that shaving a couple of days off of care coordination or a healthcare access to information process can make a difference in a kid not being in crisis, right? Or a kid getting access to care within a community schools environment. So it really invites us to pursue a uniform and singular process for holders of rights, be it health or education, to strive for singularity, uniformity, and timeliness in order for kids to get access to care. So that's the first interdependency. This is information and data sharing. Next one would be care coordination. Relates closely, right, to this idea of information sharing. We know that a large percentage of young people, students who might be served within a community school environment, are either in or at risk of entry to other systems. The research is clear about this, right? These systems are typically welfare, mental health, youth corrections, or they need something from public health, right? Identically, when parents are required to attend multiple team meetings, fill out redundant treatment and service plans, respond to similar assessment processes that are also redundant, it creates significant distress for them. Right? We know that retelling your story to different professionals in different systems is unfriendly at least, and re-traumatizing at worst, right? It's not good care. So this opportunity to close the gap in how we coordinate care and deliver uniform service is highlighted within the community schools system of care interdependency. I will point out also that caregivers and parents of the student may themselves be served by a public system somewhere. And so if that family then is in the community schools environment, and the family itself writ large is known to the school, then we increase the likelihood that the parents or caregivers can potentially be eased into or better coordinated, right? Their care can be better coordinated, but only if the system of care partners at the county are if we're doing that work effectively. So information interdependence, care coordination interdependence, and the third one would be our dollars, right? Very predictable. And this one is super critical in this early stage, right? Because many of you are involved with standing up these grant-funded community schools that Hayin's oriented us to, and those dollars are cyclic, right? They're time limited. And this is true for most of the funding initiatives that we have in California. We get sometimes as few as 2 years. At best, we get 5 years. And we sometimes make an assumption, at least people in my world, that, well, once the state's committed to it, they'll renew that grant. They don't always renew the grant. And we are only one massive recession away from having extraordinary cuts. And some of you are not, most of you are not gray-bearded like me, but I've been through 2 of these major recessions in my 35 years, and they're painful. And what we often do is we take our toys and we flee the sandbox of collaboration, because we got to protect jobs, or we got to protect a service architecture within our own silo, right? That becomes the imperative. And that's a significant impediment. And it's only a matter of time until it happens again. We could be on the cusp of one right now, right? For all we know. And so solving this, the complexities of blending and braiding the finances will indemnify the effort of standing up a community school, right, through the grant, because we'll have access to things like Mental Health Services Act, we'll have access to the Family First Prevention Services dollars, we can access Medi-Cal mental health services more readily. If the system has done its work, if the agencies at the county have done their work, and they're connected to the community school, then the community school effort is not solely funded by some grant allocation from the Department of Ed, right? You've got access to a broad spectrum of dollars, and the likelihood of sustaining that service over time becomes greatly enhanced, right? In other words, LEAs cannot succeed without the larger county systems ensuring the requisite blending and braiding of dollars. It's that simple, I think. Next slide. All right. So here are some recommendations, and want to invite Hayin to help me with this if I leave anything out. But 3 or 4 things have come to our minds as we kind of wrap this up, and then we'll get to some Q&A here. County interagency, your county interagency team, or the governing body of your system of care, whatever you call it, really should include clear and consistent connection to your LEAs. And this is part of the dilemma of 2083. Remember, the County Office of Ed is the signatory, but your districts, particularly if you're in a large jurisdiction, you have large school districts that are implementing significant service enhancements, not just community schools, but others, right? We have to connect them. So the invitation here is get your LEA somehow to your ILT. Maybe it's an advisory role, right? Maybe they come every quarter, right? Like somehow make the broader system partners aware of the community school and the significant value it brings to the kids in that part of the county, so that the county can then say, oh, that's great. Let's keep talking about how we can sustain that service, because your goals are our goals, remember, right? Second recommendation would be use that 2083 system of care partnership to engage the county mental health, behavioral health services systems. We know that this is a long standing challenge in many counties, right? The county mental health system is often underfunded, understaffed at this point in significant ways, right? We know some counties are managing a 50% vacancy rate in their county mental health systems over long periods of time now, going on a year or more. And so they need help. We need to get there and connect to them so that they know about what's happening in the community, so that they can be partners with us. And the criticality here is, and this has been in the news lately, when the governor makes a play for reestablishing the Mental Health Services Act, in essence, he's going to take money that the counties didn't spend, all right, if we're really honest, right? And if we can get to our county partners and help them spend that money effectively, then opportunities like what's happening now are less likely to exist, if we're really honest, right? So help the county mental health system understand its place within your architecture so that it can feed your community schools effort, right? Because those Medicaid dollars, Medi-Cal dollars are critical. That same system of care ILT can be engaged, point number 3 here, to identify which other agencies and their contractors are available and interested in community schools partnership. There are in most counties at least 2 or 3 others, and in some counties there are dozens, right? In our large metropolitan counties, there are dozens of community-based non-governmental organizations who are contracted vendors of the system of care partners. And those services are often very similar to or identical to the ones that the kids need or that the community school could use to enhance or leverage their continuum within the community school, right? So though, again, linking the partnership between system of care and the community school effort will go a long way towards getting kids services and sustaining those services. You can imagine, for instance, co-location, right? If you stood up a really nice community school and you had a vendor that was poised and ready, you could actually co-locate the contractor within the school environment, after hours, right? Weekends, like whatever, right? It all depends on your local plan, but there are lots of things you can do with partnership there. Fourth recommendation, use the 2083 system of care team to connect to managers to be able to evaluate and analyze the continuum of school supports. Hayin pointed out that there's community schools is one opportunity, right? But school mental health initiatives are countless. Like there are all sorts of things happening. The state's investing in school-based social emotional learning in many, many ways. And there's a complexity of funding and service delivery there that goes back to AB 114, right? And from that point forward, 3 or 4 other funding streams, those can be leveraged into the community schools effort as well. So all of that helps again to sustain and endow the system overall.
And I think the one piece that I would underscore, and I think that this is infused, and Elizabeth sort of started us off with this at the beginning. And, you know, I'm so happy to see so many of you that introduced yourselves in the chat coming from behavioral health and other non-education organizations. But I wanted, with a Zoom show of hands or a real show of hands, how many folks are here from an LEA or a county office of education? Okay. All right. Now, of those folks, Jennifer, from a county office of education, how many of you are part of really talking about instruction within education? Right? This is not about the same group of people meeting about the same things with a new opportunity and new money. This is not the same conversation over and over again. This is about really pushing on those seams and trying to really recognize that if we're talking about an asset-based way of supporting young people to thrive in schools, and we're not talking about instruction, you can have all of these folks here together from all the different agencies to talk about mental health and talk about prevention till you're blue in the face. What is going to change? Who are the new actors that need to be part of these conversations? Where are young people? Where are families? And how are we actually talking about the experience of teaching and learning? And so when it comes to really thinking about this and its implications for schools, and its implications for really thinking about, education as part of this work around human potential and community potential and belonging, we can't just have the same people sitting on top of a burning, sinking schoolhouse with young people saying, hey, there's this new idea or this new bill or this new blah, 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 or this new superintendent. Because we're going to be just doing the exact same thing. And our hope is that this is really about not just having these conversations in terms of an interagency piece, right? That's already huge. But then how do you bring that back to your home agencies, to your home organizations, and ask some critical questions around the integration that is happening within those organizations? What is the North Star for each of your organizations? And how is that putting young people at the center and their success at the center?
Hey, and thanks, fantastic. And I'll just echo her appreciation for chat. We're going to do some Q&A here. We know we've got some questions earlier in the presentation, which we can follow up on, and then we've got 3 or 4 that are coming here. I see, let's see, Sid, you I think were first to the question queue a while back around, is there an annual summary? Is there a way of measuring impact, right? What's the data on this? And of course, you've been around as long as anyone, right? And bring great wisdom to this conversation, and have been a pioneer in this work for many, many years, and know that this is an area where we struggle, right? I will say that underneath 2083, some interesting things are happening. There are 4 or 5 counties where they are developing interagency dashboards, if you will, or outcomes monitoring or measurement tools, where, and most of these are pretty rudimentary, right? Like every agency or department within the system of care is simply identifying a subset of outcomes that they're already monitoring for other purposes and just putting them into a collective space. But something magical happens when you do that. As rudimentary, as basic as that is, when you bring those data points into a collective conversation with other department heads, it can spur these moments of realization about the fact that, oh, investments in CalWorks actually leads to fewer kids in welfare. Investments in multi-tiered systems, tier 1 and tier 2, since we did that 10, 15 years ago, we've seen fewer kids in probation, right? Hypothetically. You can't always establish causality, but you can establish correlational impact if you would. So there are some dashboards emerging. I also understand that the Steinberg Institute is sponsoring a potential statewide dashboard legislation. So we may be just a year or 2 away from some kind of a collective obligation to, at the state level, to manage this, and also not to overpromise. But I understand from some of our state partners that they have developed finally data sharing agreements that allow them amongst state departments, including education, to develop youth-specific outcomes. This is referred to as the Children's Data Network, CDN. And so we're going to have sometime between 6 and 12 months from now, the first public look at cross-agency data monitoring for kids in multiple systems, which is super, super exciting. I'll have to take some of my partners at the state to lunch, because I promised them if they ever did this, I'd buy them a meal. And because I was sure it would never happen, right? But they proved me wrong. So we're looking forward to that. Some local communities have impact. Placer has a 25-year legacy of measuring its impact. Sid down in Mono, I know you're familiar with Mono, and they stood up a little dashboard a while ago, although I don't know what they're using. They're doing with that. You asked a related question around the school mental health lessons. I think we turn to places like Monterey, Ventura, Santa Cruz, really to take a look at the school mental health impacts. San Bernardino, of course, has a nationally known partnership between mental health and one of its school districts to keep kids in community, right? To keep them out of institutions. So there are some lessons to be learned. I think among the lessons that are most poignant for me is that we've never had a common practice model for all systems. No state does this, right? There are welfare practice models. There are school mental health practice models. No one has a common practice model from which we all harmonize. And California has that now with the ICPM, which I referenced earlier. And so one of the keys going forward will be, can we actually implement the practice model, which is a set of values, principles, and behaviors that align us. It's the glue of the system that keeps us in relationality so that we can sustain ourselves through the ups and downs, the highs and lows of implementation, and work in that regard.
Yeah, and the other piece, just in terms of the research and the data for evaluation, is the implementation process, right? It's not just enough to have the money, take our really great ideas, and then cross our fingers and look at the data dashboard and be like, did it work? Right. So if we're not also embedding in the work around improvement science and really recognizing that that is an enormous opportunity for engagement and voice, not only of our students and families and communities, but also our practitioners, that also requires some vulnerability and trust, that we're using data as flashlights, not hammers, to really understand how is it that we're working better together. So that type of implementation study, certainly with regards to the community schools work, not only in California, but across the country, the federal full service community schools grant program, they'll be starting working with, I believe, Mathematica and IES on a baseline implementation study, which is really great considering that this has been a grant program that's been around for at least 10 years already. But really recognizing that, it's not good intention and outcomes data don't tell the full story in terms of the developmental and the relational nature of how you build and sustain these systems.
Yeah. Thanks, Hayin. I love that. Data as a flashlight, not a hammer. That's good stuff. Let's see. Steve Hornberger was next in the queue with a question around counties that are being successful at 2083. It's hard to say, Steve. We're 3 years in, as you know, because I know you've done some of this work in a couple of counties in Southern California. I can just speak to the ones I'm familiar with. I have read all 58 county MOUs in my role with the state. I've had a chance to put eyes on all 58 MOUs. That, of course, doesn't speak anything to their success, but the ones I'm familiar with that are doing this work really successfully. Solano County has a really lovely system of care going there. Shasta, Placer, and Yolo all have historically based systems of care, and what they have done uniquely, this is the Placer model, if you will, is that within the system of care, there's one person who holds joint responsibility for welfare and children's mental health. So the architecture of those systems is unique and very powerful. Ventura, where your team there at SPI has been helping, Steve, they're doing some really phenomenal work with implementation of their system and the practice model in particular. San Diego, of course, Sacramento come to mind as well. Sacramento is going to have a dashboard that will be really pretty powerful going forward. So Steve, thanks for that question. Let's see, Crystal, you had asked a question about, New in Lassen, where you're implementing Family First Prevention Services Act. Yeah, I think there are obvious kind of intuitive connections between Family First Prevention Services Part 1 and community schools, and I'm sure Hayin has some thoughts here, but I think I don't know how concrete the planning process in most jurisdictions will reflect a connection to community schools, because I'm sure that there are some historical places where there are community schools already present on the ground, right? Not CCSPP funded, but they've been around for a while. Those counties may be in better position to leverage into Family First Prevention Services Act, but the timing on this is a little awkward. Hey, and do you have thoughts about that?
Yes. One is, you don't need CCSPP funding to be working on a community school strategy. You don't need full service community school funding to be working on a community school strategy. You don't need any funding that says, are you or aren't you a community school, right? So the push really here is around what both Richard and Elizabeth have already talked about in terms of what is that shared vision and who are the folks that are moving this work forward, who is engaged in this work to be able to move this forward. There's so many conversations that are not explicitly connected and are integral to the success of a community school strategy. Students with disabilities, huge when we're talking about inclusion, right? I recently saw a set of job postings for a district that was really excited about this new school that they were in, a new community school that they were opening in partnership with a community-based organization, specifically for foster youth and all of the other young people that have not been thriving in general education. That's not cool. That's not inclusion, right? That's not promoting a sense of belonging in terms of a shared responsibility for young people's success. So how can we think about what it means to really lead with this mindset and build systems with this mindset? So my invitation to you, Crystal, to say, like, bring it up, talk about it. And not even, do we have a CCSPP grant? And should we be doing community schools? But who are we working with? Where are the voices of our families? Where are the voices of our young people? What is the data? How do we know who is doing well in school? Is there a conversation happening in any interagency way around thriving young people within schools? How are you making use of out of school time in all of those ways?
Yeah, I'd echo that. And it's hard to know sometimes where those conversations are happening because we're all in our own silos, right? But the ones that come to my mind, I mean, we talked about the interagency leadership team that meets hopefully on a monthly basis, if not more so, Crystal, but I don't know in Lassen. Much of your system of care work has been led by your wraparound folks in Lassen, Health and Human Services, Jason Vial, I think is his name, but so I don't know who to connect you to FFPSA work, but on the education side, your county office of education convenes, I think, like a superintendent's council meeting or a SELPA directors meeting, right? Like there are a couple of meetings on the school side where you could, if you could find the right person, you can say, hey, could I come talk to you about this? And then follow up on, with Hayin's recommendation, just go there and have a chat, even if it's 10 minutes on their agenda and say, did you know we're doing this? And from that sometimes comes amazing opportunity. I think we got to Steve's second question. It was identical really to Crystal's question, but we've got a couple more minutes. Happy to have you come on camera, raise your hand, ask a question orally. Let's see, build the relationships. Yeah, thanks, Hayin.
Teresa.
I don't really have a question, but I thought at least we should go on camera now that you're not doing a presentation.
Oh, thank you.
Just because there you are, and I know how it feels to do a presentation and nobody's looking at you. But anyway, this has been very valuable. Fred Finch Youth and Family Services here. We do a couple wraparounds. One is with the regional center, so very specialized, and another one is with the County of San Diego. And we also do CFTs. We have other services, but there's truly an intersection with everything that you're talking about. And I love this discussion because it's really about reframing how we do things and using our resources to the highest capacity, which isn't easy these days. When you talk about workforce, because we have I think it was you, Richard, that talked about 50%. Some counties are down 50% in their workforce, and so are we in the community-based sector. It's just especially for not every category, but in particular for licensed clinical practitioners, we're super struggling. So
yeah, Teresa, thanks.
I also wanted to bring up, Teresa, I'm so glad you're here, because I think oftentimes when we talk about education and what we're seeing, sort of ironically and disappointingly, is that community-based organizations and community agencies have not been part of the conversation, because the money is coming from Prop 98, because this is getting funneled through the systems as they usually are. That is a massive oversight. And so for those of you all that are in those conversations, we need to do better at making sure that community-based organizations and community are part of this conversation. It is our community-based organizations that oftentimes reside, and those staff that reside in communities, that have relationships, that have connections, that have the trust, particularly at times when our young people and their families are most vulnerable, especially if we're talking about some of our mixed status families, or those without documentation, or any folks that have experienced trauma at the hands of the public system. How can we not include our community organizations? So, the sort of impulse, the knee-jerk sort of reflex is to say, well, we've got the money now, we can control where things go. That is the exact opposite of this invitation. And it's scary. And it should be scary, because if you're not scared, you're not going into this work the right way, right? But it's a matter of having some vulnerability and support to be able to bring those relationships and those connections together.
Yeah. So powerful. We know that care in community is more accessible and less stigmatizing to kids and families, right? So we have two major drivers that just continually invite us to enhance our public support for community-based private delivery systems. Other questions, curiosities?
I'm kind of curious to see. Hi, Elizabeth Aday, Fred Finch. I'm just kind of curious with all the discussions to see where enhanced care management, ECM, that's the new, fits into all of this, because that kind of focuses on, addresses the social determinants of, of health. How do that kind of, how do we kind of wrap that into this system of care when we are talking about, because I mean, children right now are kind of that population of focus right now going into July 1st. So I'm kind of curious to see if you've heard anything or what your thoughts process is about this new initiative.
Yeah, such an interesting dilemma that we have well-intendedly created in California. And if you're unfamiliar with what Elizabeth was talking about, underneath the CalAIM reforms, there is an expansion of intensive services. We call it enhanced case management. A lot here, right? But the dilemma that you're highlighting, Elizabeth, is that within an ECM model, enhanced case management, often it's designed to be almost like wraparound, right? Like it's a whole person approach, a health home, right? That connects physical health and behavioral health. But if we roll out ECM in a particular jurisdiction, particularly for foster youth or kids in the child welfare system or kids in special ed services who already have a home, hypothetically, right? They've got an integrated home, but we have now an ECM integrated health home. Then we've just layered complexity for the family, right? So it creates this dilemma back to coordination of care. Like, how do we communicate with the family that there's only one team? We're an integrated team, and that we cannot make their lives more miserable by having them go to multiple competing places and people for the care that they need for really complex issues. I don't have an easy answer for you. I know that it's going to be a challenge. I suspect big picture here is in many small rural counties, they will ignore ECM, in part because the rates are not great, right, for funders, the provider network. And the public systems are not prepared to adapt. I know social service agencies across the state are saying, we think it's great, but we can't do it. We don't have the people or the infrastructure, right? So I think where ECM will be impactful will be some of our larger jurisdictions where they're prepared and resourced in ways that they can perhaps fix this link that's inadvertently created here. Yeah.
Thanks, Richard. Thank you.
It's going to be an interesting dilemma.
I think that piece, Richard, that you're talking about, to say community schools, right? That's a great idea, but we don't have the staff and we don't have the money to do it. So, oh, well, there goes that, right? There is certain, one of the things that we try to underscore sort of emphatically, jumping up and down, waving our hands, is that you're working right now, you have a sphere of influence, you have relationships, and you have resources. How do you start to move and direct attention in those ways, right? This is sort of building the readiness for when you do have the staff, when you do have the money, because it's the way to go, right? We need to start building that muscle memory now, even if you don't have sort of the dedicated funding to do so, or the dedicated resource. But if you are building those mental models and those relationships and those relational infrastructures, that's incredibly important. And what we're seeing with now out the door, almost $1.5 billion already out the door with CCSPP. The funding, the tail is wagging the dog. That's not how this work is going to be sustainable and successful. You know, this work around integrated partnerships with schools and community, you know, Healthy Start. We've seen all of this before. But if this is just dependent on new money or a particular grant or a particular allocation, and we're not actually talking about the mental models and the infrastructure that Richard has been working on, then let's just wait. Let's just say, oh, that is a good idea, but oh well, for me, right? How can we take responsibility for the sphere of influence that we're in? How can we take responsibility for the resources that we do have to start to create these new relational synapses, these mental models to be working in this way?
Exactly. All right. Seeing no more questions and realizing we're just about done, let's invite Deanna to call back up that slide deck. And the final slide has some contact points. You'll get this, of course, in a follow-up email. But if you have a desire for any additional follow-up technical assistance, Hayin is the expert in California on all things community schools. So you can get to her and her team at CSLX. Happy to converse with you at the Integrated Human Services Group, and of course, Breaking Barriers. You can contact us there through that email. There is a symposium coming up November 14th, 15th, and 16th in Sacramento. We'll be diving deep on some of these things and would love to see you and your partners. Bring a team of people from your county. Bring your social service, welfare, probation folks, mental health folks into that conference. And final appreciation to Deanna, Jamie, Natalia for their support today. We would not have gotten here without folks working diligently and passionately behind the scenes to get us to this point. Thank you so much for all of that. And with that, I think we will bid you adieu until November. We hope hopefully see some of you in Sacramento in November. Thanks a lot.
Bye, everyone.
Bye.